There's a great interest in trying to differentiate data sets or additional information that would allow us to make a decision on what is the best regimen to start someone who's transplant ineligible and they need first-line therapy for their multiple myeloma. We have very good data from the SWOG study 0777 as well as from the Mayo trial. And we have done some comparisons, have used real-world analysis of various data sets to see if we can make a decision of which one of those two regimens is optimal. We don't have a head-to-head comparison, and both come with level 1 evidence recommendation in the NCCN guidelines. So this is one more study in that direction. What we did is we looked at database for Accenture and looked specifically at time to next treatment. The time to next treatment is not a perfect surrogate for PFS and has some limitations, but also has some advantages. One of the advantages is that it doesn't necessarily and exclusively depend on progression, but sometimes patients have to stop treatment because they have some comorbidity or toxicity related to the drugs. So it's another way to look at the clinical benefit of a given regimen. So we looked at a comparison between the Mayo regimen, Daratumumab RD, versus VRD. And what we found is the time to next treatment difference, and this was with essentially 200 and 400 patients in those two arms, was nearly double. So it was the 38 months for patients who receive the Mayo regimen versus 19 months for those who start with VRD. Now we acknowledge and have always stated this is not a definitive randomized phase 3, but given that these two regimens have level 1 evidence, this is one more data set that points towards the use of the Mayo regimen as a preferred regimen for frontline therapy. And although this is not addressed in this study, I always like to highlight this is a regimen that does not cause peripheral neuropathy. The peripheral neuropathy will have a major effect on quality of life of patients. So we're excited about this study and are looking forward to the comments by people who go by the poster.